Thank you very much, Catherine. As you have noted, I've spent most of my life working at the United Nations, but even before that life, I did have a life in Pakistan, where in fact I started my career and where I got a lot of my experience and where I started to make the connections between women's health, women's rights, the whole circumstances in which they lived, and their health, particularly their reproductive health, and how their decisions on reproductive matters were really not their decisions, but really controlled by men, by their families, and by what society expected them to do. So, in a sense, the whole International Conference on Population and Development came out of that evolution of ideas, which connected women's rights with reproductive health and rights, and their present situation and continuing ill health and the lack of attention still dominates policies around the world. At that conference, 179 countries agreed to secure universal access to reproductive health care by the year 2015. And as we know, we are still a long way from there. That was in 1994. The question that's posed to me today is, what must we do to reach universal access to reproductive health and family planning? And my simple answer would be just implement the International Conference on Population and Development. All those recommendations, we've all agreed to them, and they have been reinforced in many subsequent meetings. But I know that's not how you want me to answer that question. How have we done so far, and what do you think should be done in the future? I think that's a huge subject, and time is short, but so I'd like to make just three brief points. One of them is actually being made by Dan, that progress in my travels in a large number of countries, I've been really enormously impressed by the strides that have been made, not only at the national government level, but at civil society levels, and in particular, the women's groups and women's organizations on, getting the two sets of rights together and working on them. Reproductive health care and services has become a normal expectation in most of our countries. I'm not just talking about family planning, of course, but reproductive health in general, because the whole idea in Cairo was to have an integrated set of services which include reproductive health, and included family planning, sexual and reproductive health, and also rights. Also means motherhood. It also means treatment and prevention of sexually transmitted diseases, of which HIV/AIDS today is one of the most predominant ones. The idea that all women and men too are entitled to reproductive health and have the right to demand it and to make the decisions for themselves is really being accepted, but of course it really lags in the implementation. And this brings me to my second point, that there's a huge gap between expectation and the services that they were expected to have been provided by the year 2015. It's already 2008. We're really very far from doing that. It's a fact that more than 6 out of 10 women in Africa, Asia, and Latin America now do have access. But this covers the real picture, because you get access in some of the larger countries which are richer, but you don't have access in most of the poor countries, a lot of the developing countries in Africa, and in fact in a large part of South Asia, where a huge number of the people of the world live. There is progress, but it is also a fact that most of these women are in the 12 larger countries, as I just said. Many of these services are not complete. Life has changed very little for a lot of the women in the world. They do not have access to all the family planning, antenatal care, or skilled attendants at birth. They do not have HIV/AIDS prevention information and services. They do not even know that they have the right to demand these things. And that's one of the issues that we really have to deal with as far as rights of women are concerned in many of our societies. Many health systems, and I would say a lot of health systems, even though there's so much attention being given to women's health and reproductive health and family planning and HIV/AIDS, which are all in the same bunch, but they still do not give enough emphasis to the whole holistic approach to reproductive health care, even in some of the middle-income countries with well-developed health systems. So we should ask the questions, why do countries put prevention and caring for HIV/AIDS patients ahead of, for example, helping women protect themselves from those infections? You see the increasing feminization of HIV/AIDS is the question that I keep asking. Why, we are doing so much for HIV, and I'm a special envoy of the Secretary General for AIDS in Asia and the Pacific, and I keep saying that while we are, looking at prevention, we are forgetting about half the population of the world, which is increasingly getting infected with HIV. And even here in this country, even though I'm not responsible for the US, the African American population is really being, very much decimated by HIV. Shouldn't use the word decimated, but affected by HIV/AIDS. And there's not much attention to that issue also. Many African women are getting affected in the United States, and it's something inherent in being a woman. I often ask this question, what is it that makes all these policymakers forget that women are half the population and need their rights and need them now?